Jethwa
So
sir will be
my
talking on my experience of dressing the wound.
so I'm going to give some peculiar points. So thank you very much for giving this opportunity. My point is simply that wound says if you can watch. It's a very important point that you have to be with wound. And I have no disclaimer, no financial affiliation, no promotion. So what I'm going to talk about is first is an overview that preparation is very important and inform the patient that you are going to do dressing. That makes a big sense in their pain when you are doing dressing. You have to be see that the patient is comfortable and you are also comfortable. Otherwise, you don't do. So what is very much important is as far as possible do dressing in dressing room and on couch so that vasovagal does not occur, not in a sitting position or other position. There has to be good light. If you are older and older, there has to be more and better good light. Check all the materials, sterility, expiry, quantity, lab test materials, no relatives, very, very important. That gives a big trouble. And please, as Chaudhary sir said, document every time. So this is very important. So now what I'm going to talk about is only silent features. What is dressing? It is no less than a minor operation. How do you dress? Communicate with the wound. Do not remain as a dresser. Every time wound is telling you something and something else you have to do. That is very important for when the wound is giving some trouble. Now, very quickly, I'm going to give some tip. When you use micropore tab, what happens? That this is the bandage which is applied. Then you apply this micropore tab. Then it sticks so much that it's difficult to take it out. So the idea is that at the edge of this tab, you make a little bit of small winding so that that tab does not become a stickable. So when you go and just open it up with a finger, you can open up the edge. So this is the tab, you band it fully. So it is very easy to open up. So it is very important that you unwind it. Now regarding Savlon, Savlon is a fantastic antiseptic I am using till today. But the most important problem which I have seen in across all corporate hospitals is they do not know how to dilute. Please see this. 1 in 15 parts, that means 200 ml of Savlon makes 3 liters of total solution for dressing. Now this is very important. And so you do not have such problems because of the concentrated Savlon. Benzoin is a very good antiseptic. But where do I use? I do not use it on the wound. I use it surrounding the wound. So what happens? It sticks the micropore very well, especially over the joint, especially when you are asking that over the joint there should be a stretchable thing. So what you do is apply this micropore in a flex position so that when you extend it will not come up. But once you have used benzoin, it sticks so well that it will never come up. Usol, do not go with expiry. Always ask your staff to smell it. Is it a really fresh one or not? Jensen wallet, again, another wonderful anti-allergic solution. So whenever there is any allergy like this, use Jensen violet. Especially I have a patient where there was a too much of reaction over the wound, where you simply apply 3-4 days of Jensen violet, everything will heal. It's a very good thing which you should have in your dressing trolley. Saline wash, very important. When you have a deep wound, when you want to do saline wash with a needle, with a pressure, please see that you do not use the needle full because needle might disengage and go into the wound. And so many times it has happened. So cut the needle over here and then use it as a jet. It's a very important thing so that you do not hurt the patient. Then transparent tap. So many things have been told by Agassi sir that there is a very high cost. So my solution is that there are low cost transparent taps available of 5 meters which are non-sterile. It's a simple tap. So what you do is you apply over your normal dressing. So it becomes waterproof. So this is a very simple way. You can apply over here and see at the joint also you can apply it, but at the joint be very careful. You flex it and then you apply. Elevation is very, very important, and especially slab is more important when the wound is around the joints. Key was to strengthen the skin suturing, which is very important. When you get such a flap in the heel, what you do is you do not take only sutures, but also give 2 or 3 K wires through the skin to the bone. So what will happen? You can squeeze out the collection very well during the dressing, and it fixes with the bone so well. This is very important. But another very important point is avoid caking, which occurs after 24 hours. What is caking? There is a normal hematoma which has come out, which dries up inside the gauze space. The drying up becomes a cake, which pressurizes on the wound edges and it causes ischemia to the wound. So please remove this, which occurs after 24 hours. Then Hilux spray, a wonderful thing. Do not keep the wounds open. Apply this Hilux spray. Hilux spray is going to give you a lamination, which is a sterile one. It remains open, yet it is covered with a thin layer of this particular material. Helix seal is another very, very good thing, which I use in any injection, which I give intra-articular injections everywhere, where you just use a small part of a cotton and then you apply helix spray over it, it sticks out, it dries up, it remains very much for a long time. Or you can use a very small band-aid over any such local injections. Huge blisters when are there, do not just cut it open, put a needle at the edge, drain out the fluid, keep that protective skin over there. It's going to give you a painless dressing subsequently. It's a good coverage, so do not remove the whole cover. This is what I was talking about. This is not a fully healed wound. It is a delicate one. Protect it for a pretty long time so that it does not go with a tanning or hyperpigmentation. One more thing very important is that if you want a painless dressing, use a absorbable skin sutures, which is monocryl. So this is I have used, this is the monocryl, which is inside that skin for the volar plating. This is the monocryl which I have used for the ulnar plating. This is a very good thing, and there is no need to remove the sutures, but it is very painless. Very, very important thing is that do not forget to correct ischemia, anemia. So many times we do so many dressing, but we do not take care of hemoglobin. Once the hemoglobin is raised, you will see a fantastic difference in the wound healing. Regarding dynaplast, we have a problem of removal of the adhesive part of the skin. So spirit and nothing will work. Use distilled turpentine or the thinner which is available for the paint. That is going to remove your dynaplast remnants. For the skin removals, do not use tooth forceps. Use a small mosquito forceps that catches. So once you catch with the tooth forceps, you take multiple times, and that gives the patient pain to the patient. So use a mosquito forceps so that you catch all very well. Use good quality bandages. This is the quality I am using. To me, it costs 80 rupees per bandage. It's a very high cost, but there are very good bandages available. So use that, and do not cut the bandage while doing the dressing. You can unwind it. Unwind is easy, but as I told you how to apply the micropore, tap on it. Preserve scab. This is very important. For any external fixator, do not remove this scab because it is the most protective. Removing that will invite multiple dressings. But you keep the scab, it will remain there for 6 to 8 weeks. These are the different ways by which I prepare my dressing tray, including the metallic tray. This is very important. When you get a patient in casualty, before doing anything, before even applying antiseptic or a saline, take a swab. 30% of the time you will be able to know whether it is going to go for infection or not. The contaminated wound itself gives you some hint. So send that swab before touching the patient. That is a very good thing. And now, quickly I'll go through no vac machine required for the vacuum dressing. So my point is that use only the sponge and not the whole vacuum machine. A couple of only some of the cases. This is the case where compound injury was there, plating was done, and it has healed with only a sponge. There is another case which shows that there is a tendoachilles repair which has been done, again giving a problem. Only sponge was applied. At the end, there was a fantastic healing. There is another case where there is an unhealthy skin. Over there, the infection has occurred at the lower end. There was a pus coming out. I debrided, put a sponge multiple times, and there is a good healing, complete healing. One more case where there is a finger infection, pouring pus. I just debrided, put multiple time, only sponge. It sucks up everything, complete healing. And there is a late infection in open femoral nailing, where applied the same way, sponge multiple times, and at the end it goes for a complete healing. One more case where there is a component with a multifragmentary tibia, where two sides were there. I put this sponge, and you can see that it comes out very well with a complete dried up. There is an amputation where resection, or rather a complete amputation was done, complete healing because of this sponge. And I also use sponge for a fresh case where you have a wide exposure. So postoperatively, you put this sponge on immediately postoperatively, and then it will, you see that it is completely dried. These are the cases where there is a horrible foot injury where amputation of the limb was done, and there was a big problem with the blisters and all this sort of a story, where I went on using sponge, and at the end, with a multiple sponge dressings, I could get day by day good healing. And at the end, you can see that there is a good granulation. I put STG. Over the STG, again, I got some spot where there was a oozing. So again, used sponge. And at the end, you can see this is the way it was a very bad one. With the sponge, it has gone for a complete healing. So this is my uh, advice on using only sponge, that is going to give you the same result as vacuum, and it is the medicated or the medical range sponge which you have to use. Here you can see that when you remove this sponge, there is a complete dried up because it sucks everything. Of course, you have to apply it as dressing over it. So I thank you very much for this opportunity, and I just wanted to share some of my peculiar observations and experiences which I practice.